Hello, I am Dr. Alyssa and I will be doing your face exam today. What brings you in? Yes, it is obvious. I just need to confirm that I have the right person. Okay. So can you go ahead and tell me your date of birth, please? Okay, good. And so, face exam. Can you tell me a little bit about what happened? Okay. So, you're just wondering about a procedure. Okay. Alright. And yeah, how did this happen? A bar fight? Okay. Okay. Yeah. And have you sought out any kind of medical help before coming in here? Has anything been done, either surgically or superficially? Just anything before this? Okay. So you just left it, and that's how it healed. Okay. Was there glass involved at all? And you didn't seek medical help? Okay. Okay. Before I get started, do you have any allergies to latex or any certain medicines? Anything like that? Okay, and I am going to take your temperature just to see. Yep, right under your tongue. We want to rule out any infection. How long ago did this happen? A little over a week. Okay. Yeah, because it looks like some of it's still healing. Very good. Okay. Alright. So, you don't have a fever, which makes me think you don't have an infection. Let me take a look with my light before I start feeling around, just to make sure that that there's no visible glass. If there is, then I won't be pressing on it. We don't want to make it any loose. So I'm going to turn this light on. If you have issues with light, you can go ahead and shut your eyes while I do this. Otherwise, just pick a spot to look at so you're not looking directly in the light if I go over your eyes, okay? Alright. Okay. And was there a sign that this was like more severe on as it was healing, like right after it happened? Okay. This side? Okay, yep. Pardon me, my lip is bothering me. Okay. Yeah, I'm not seeing any glass with my eyes. Let me... Got a Q-tip ready. I'm gonna start feeling around now, okay? I'll be gentle at first. Let me know if you feel any sort of pinch. Anything sharp. So that way we can get a better look at it. Feel across your forehead now. Alright. Anywhere there bothering you at all? No. Okay. How about your jaw here? Okay. And was everything alright with your jaw afterward? Didn't feel dislocated or anything? You can wiggle it around. Okay. Yeah. And no issues with opening and closing your mouth. Like I said, no dislocation of your jaw. Nothing like that. Okay. Alright. Anything here? This is where it's the most affected that I can see. A little bit of a pinch. Okay. I'm going to take my finger and run it over it. Tell me where you feel it. There. Okay. So let me just. Okay. I'm gonna take two of these. I'm just gonna try to. Okay. Yeah, there was a tiny, tiny piece there. So in most cases, if anything is stuck in our bodies, either we will deal with an infection or our body will absorb it and break it down in a sense. So if there is or was anything, it most likely was absorbed. What kept you from seeing the doctor, like an ER doctor at first or so? Okay, yeah. Okay. So, I'm going to now just feel the structure of your face, kind of under the scarring. I'm going to ask you to do some movements as well, okay? So let me just, again, reevaluate here with the light now. Okay, so we're at the jaw. Just go ahead and open and close your mouth for me. And can you wiggle your jaw from side to side? Good. Okay. And is there any pain at all with that? Okay. So I'm going to try to open your mouth, alright? You keep your jaw locked, okay? Yeah. Alright. Very good. And now open your mouth for me and I'm going to try to close it. Okay, no pain with that? Very good. Okay. Let's try your eyebrows. Just can you raise your eyebrows for me? Okay, and can you go up and down with them? Very good. And can you furrow your brow there? Good. Okay, and I'm gonna have you raise your eyebrows. Don't let me push them down. Okay, now lower them, and it might be a little. I don't expect you to not be able to make me, because I guess if you furrow them, keep you from pushing them up. Okay, yeah. And then around your eyes, go ahead and close your eyes. Just gonna. Did anything get in your eyes at all when this happened? I'm not sure. Okay. Yeah, I'm gonna use the light again. And just pick a spot behind me to look at, please. I'm just gonna check. Reaction's good. And then I'm gonna pull your lid down here and just take a look. And over here as well. Very good. And then go ahead and look down for me. Turn your lid up. Same thing for over here. Okay. And no sharp pains with your eyes at all. Nothing feels like it's in it. Okay, avoid a corneal abrasion and just obviously having anything in your eye. I don't see any redness or any visible tears that might have occurred, so that all looks good. So you said you were interested in a possible procedure because you got a little bit of scarring going on over here now. Yeah, it'll continue to heal kind of how it is, and you will see bumping there. So if that's what you're interested in a procedure to kind of correct that, especially before it completely heals, then I can definitely refer you to someone. I just kind of do the exams and do the first looks, but we can get you to a surgeon. Yes, and I'll find a good one for you to use. And I'm gonna just do some measurements for the surgeon just before and after. Do you have any pictures of yourself, preferably head on, where we can see what your face previously looked like without the scarring? Okay, yeah, that'll help the doctor, the surgeon. And I'm gonna take some measurements of some things now. Let me see about how big this trouble spot is here. Okay. And are you mainly concerned about this area here getting fixed, or you have little bits of scarring starting over there? You want to wait and see how that one heals. Okay, so would you still like me to take measurements of it so we can get that to the doctor if you change your mind? Okay. Yeah. For a surgery like this, it is going to take a little bit to, you know, get into the, not the surgeon's office, but just like getting to the surgery. Yes, because facial surgeons are quite busy, yeah. Okay. And then, just get some. Okay, can you rest your face for me again? I'm gonna do. Yeah, there's quite a large space there. Now, can you open your mouth for me? Like, please. Okay, I'm just gonna measure about there's any changes to the size when you move your face. So, and can you blow your cheeks up? Is that possible? Does it hurt at all? Okay. Yeah, if it hurts, obviously, I wouldn't want you doing that, but you said it's been like about a week. Yeah. So, there might not be too much pain with that anymore. Let me see. Okay. So when you go in for the consultation, they will take before pictures. They'll take a picture of everything that's going on as the before, and then after the surgery and you've healed up, they'll take an after like that. And that's why I said if you have a picture of yourself face head on, then they can use that as a model to try to recreate anything if they have to absolutely recreate something. And yes, so let's move on to cleaning you up a little bit and just do a quick clean over so that way if anything is lingering we kind of stop it in its tracks. I just had to absolutely no pain now at all. Okay. Yeah, I didn't see a fever. No, I'm not going to bandage this. Did you have it bandaged at all? For the first couple of days? More spots? Okay, yeah. Yeah, we still want it to be able to air out. And heal up as best as it can. If it gets too moist, it could also cause infection, so yeah, just want to let it kind of do its own thing. And yeah, so your face will kind of dry up from the alcohol wipe there, and it should all be good. Do you have any other questions? Yes, the receptionist can get you the contact for the surgeon, as well as I will reach out to them and let them know. And you can get that ball rolling after you have that information, okay? Perfect. So, okay. So quite a few dogs barking today. Not sure why there are dogs near the doctor's office, but alright, so yes, I'll give the doctor, the surgeon, the rundown of what you told me, like notes I took, and then measurements and just general areas where the doctor will be looking, so they're aware. Okay. And that way they'll have most of this information before you go in, but you will still have to you will still have to tell the surgeon everything that happened and just kind of go over it all again. All right. So we got right side is okay. And yeah, okay. So I have everything I need. Are you sure there's nothing else you need to ask or let me know about? Okay. Okay. Alright, we'll leave that up to the surgeon to ask you more specific questions about medications and things like that, okay? Alright, so, thank you for coming in. I'm sorry that this is the circumstance. Bar fights, though, yeah, they can be a bit rough, so, yeah, well, I'm glad I could get this looked at for you and get you headed to where you need to be going or where you want to be going to make yourself feel better, okay? And, yeah, so you can head out to the receptionist there and she will get you all the information you need moving forward, okay?